So, during the procedure, we found two main areas of blockage in your father's coronary arteries. The first was in the left anterior descending artery. It's the coronary artery that comes down the front of the heart and is probably responsible for the largest area of heart muscle. That artery, called the LAD, has a very severe blockage at the near the top of the artery. There was also some degree of blockage, though to a lesser extent, in what's called the right coronary artery that comes obviously off the right side of the heart and into the bottom. That area there is some blockage, but it's much less severe than the LAD. There are sort of two options as to how we go forward with this, and we discussed it with the cardiac heart surgeons as well. The first option would be to wait and do an open heart plan and open heart surgery to fix both of these areas of blockage. However, discussing, with your dad being over 80 years old, there is some risk for it's a very big and involved surgery. And speaking to your dad in the procedure and to the surgeons, they think that it might be risky to do a big major heart surgery like that. The second option is to fix the biggest blockage, the left anterior descending, with a stent today, now during the procedure. And I think that's the way that we're going to proceed, or that is the way that we're going to proceed after talking to your dad and talking to the heart surgeons. So right now they're working on putting a stent. It's an expanding metal tube that will go.
That little thing.
We use a balloon as well. But we pass this metal tube into the artery through the narrowest part, and then use a balloon to expand it so that the diameter goes back to normal, and that stent stays in his heart to keep that area open for the rest of his life. After the procedure, he'll stay here at LAMC to recover. And then he'll need to be on two medications that are going to be very important for him. One is a baby aspirin every day. I know he was already doing that recently. That's a lifelong thing. He'll need to take that forever. The second medication is sort of a super aspirin. It's another type of blood thinner called Plavix that he'll take also once a day for at least 1 year after the stent is placed. And then up to the discretion of his cardiologist as to whether that can be stopped long term. The reason that's so important is because the stent is made of metal, and it takes a while for the tissue to heal around it. And so while the metal is still exposed there, it actually can increase a risk for a blood clot to form on the surface of the stent. So he needs these two blood thinners to prevent that from happening, because if a blood clot forms inside the stent, it could cause another heart attack that could be very serious. So it's really important that he takes those medicines every day, and for the aspirin for life and the Plavix every day for a year. And we'll be very clear with him in instructions and everything like that when he leaves the hospital.
He didn't have a heart attack though.
So
it's another heart attack.
So I will say he technically did. So just to be clear on the terminology, when he came into the hospital on the 18th last week, he technically did have a mild heart attack. He did have. So how we define it's sort of a little bit squishy how we define it, but anytime that there's an elevation in what's called the troponin level, it's a protein that lives inside the heart muscle cells, and when there's an injury to them, it leaks out into the bloodstream, and we detect that on his blood tests, and his was elevated. So there was some injury to the muscle of the heart itself at that time, which is sort of how we define a heart attack. It wasn't super high, but it was still high enough that we were alarmed about it. So okay. So that's where we're at right now. They're going to put in the stent as we speak, and then he'll come back here, recover for a little bit, but we'll stay here tonight at this hospital. Okay.
And I can stay with him, right?
Yeah.
Okay, cool. And you're Dr. Michael?
Yes, I am.
Yes, doctor.
Okay.
Thank you.
Yeah.
What's your last name, doctor?
It's just Ho, H-O.
Thank you, doctor.
Okay. Yeah, okay.